James tell us when we're live. Okay, hello. Welcome everybody to meeting of the Employment Committee of Portsmouth City Council. This is being live streamed, so if we go around and introduce ourselves so that people know who everybody is. I'm Gerald Van Jackson, I'm leader of the City Council and chair of this committee.
Councillor Jeanette Smith, spokesperson for PPP on this committee.
I'm Darren Sanders, I'm one of the Liberal Democrat councillors.
Lewis Gosling, Conservative spokesman.
We have apologies from Matt Atkins, who's not available to be with us, and a late apology from Cal Corkery, who has been hung with a close contact who's got COVID, and my thanks to him that he's taken the very responsible view of not being here, and he's got things he wants to say, and we'll try to input that into the committee as we go round. So we're joined by colleagues, and let's go round. And David, do you want to start and introduce yourself?
David Williams, Chief Executive.
Richard Locke, I'm the Council's Procurement Manager.
Natasha Edmonds, Director of Corporate Services.
Meredith Hughes, Assistant Director of Buildings.
Peter Budd, Assistant Director of HR.
James Harris, Senior Local Democracy Officer.
Okay, thanks very much indeed. The usual thing, they're not expecting a fire drill in the Guildhall, so if it goes, it's real, and we meet by Queen Victoria. Okay, thanks very much indeed. If we then go through, we've had...
Sorry, Chair, can I do a point of order?
Of course. Yeah,
there's no standing deputies here.
Correct.
So are we quorate?
We are, I understand we have to have 1/3 of the committee to be quorate, so we're quorate at 2 out of 6.
Right.
So...
But it's a bit disappointing the standing deputies are named and not here.
Yes, absolutely. We've been having the same issue with the planning committee as well.
Okay. How are we solving this issue?
It's down to groups to decide what they wish to do.
Okay.
So it's not within our power to insist people come, but I think you're right. It is always to be regretted.
No, I just think it's disrespectful to officers who are taking their time to come here. There's quite a few here today, and councillors can't even bother to turn up. Disappointing, well, really.
I know Councillor Cal Corkery only was able to notify us at 11:15 today, so I think his pinging was very recent. But anyway, I think the point is well made, and thanks. Okay, colleagues, can we just go through the agenda? First of all, it's the minutes of the previous meeting, which was held on the 2nd of March.
Chair.
Sorry.
The declarations of interest.
Oh, sorry. Any declarations of interest, colleagues?
Yeah, I have one. I am a full-paid official of Hampshire Branch Unison.
Okay, thank you. Any others? Nope. Okay, sorry, going back to the minutes then, 2nd of March, of the people who were there, I'm the only person. James, what do we do?
Thank you, Chair. So it's up to the committee as a body to agree the minutes. So if you are content as the remaining member of the former committee, then it would be signed so long as all of the other members of the committee are also content.
Colleagues, are you all right with that? Okay, thanks then. Thank you very much indeed for that, colleagues. Okay, let's move on to the living wage. Who is going to start walking us through? I can see lots of people looking and saying it's you, not me. Natasha, you've drawn the short straw.
I will start, and then I will hand over to Richard for a further update. So the report in front of you was prepared for the July meeting. that unfortunately was cancelled. At that point, some work had been undertaken, some further work had been undertaken to progress the work to attain accreditation for the Foundation Living Wage. A lot of that work focused on procurement because, as the committee has previously been advised, all council staff are already paid at the Foundation real living wage rate, and that increased to £9.50 as of April this year. There was previously one local authority maintained school that hadn't adopted the real living wage but has done so now. So the further work and update relates mainly to our procurement activity. At the point of time that this report was written, a series of activities had been undertaken to look specifically at our contract pipeline and to identify those contracts that were the most likely to fall into the high impact service areas, so we could better understand the impact of adopting the real living wage and the impact on key suppliers. That work has now been undertaken. Work has also progressed to draw up a list of documentation that would need to be altered in the event that the council does adopt the real living wage in terms of our procurement gateway processes, to create templates, contract terms, contract management processes, etc. And engagement has been underway with colleagues who are involved in managing contracts and commissioning services. But there has been further work undertaken and more work planned in the immediate future. So I will hand over to Richard to update the committee on what further work has progressed since July and the plans for the immediate next steps.
Okay, thank you, Natasha. So, main pieces of work that have been progressing is developing the contract pipelines. Since we implemented the Fusion finance system, we've got much greater visibility of all contracts across the council. Colleagues in my team are also looking at other finance systems such as Controc, which we use for adult social care payments, which is probably the highest impact area we've got for living wage. So we're in a very good place in respect of knowing what the contract pipeline would look like if we were to move to living wage accreditation from April next year, if the council adopted that. We'll be able to see what tenders are coming up, what renewals of contracts are coming up, because it's at that point over a 3-year period, ideally that we should then be uplifting those relevant contracts. Alongside that, we're also beginning some work to properly engage with high impact providers on a qualitative basis. So we're working with colleagues in adult social care contracting to identify key suppliers, whether that's from domiciliary care, from day services, from residential care, and to pull those together into focus groups where we can really talk and discuss what the potential impacts, positive, negative, neutral, of bringing living wage in could be. Alongside that, we will then produce a survey that will back up some of those findings that we make through those focus groups. But one thing we're really keen to do is to make sure we get a proper voice from the contracting market, particularly in adult social care, that we properly understand the issues with them, rather than just do a quantitative survey basis. As Natasha was saying, the other bits of work that we're doing is also to look at the implementation in terms of procurement governance, contract management, reporting. In doing that, we will also engage with peer organisations who have put living wage in place. We have quite a range of them. That there's Norwich City Council, which would be an ideal peer organisation to speak to as a unitary body. There's quite a few others that we've got on the list as well.
Norwich isn't a unitary. Norwich is a district council.
Oh, apologies, I was under the impression it was a unitary. We'll
being
find
a local government for as long as I am, being the sad git, it isn't. It's part of Norfolk County to social services.
Okay, we'll review the peers that we will speak to. Thank you, Leader.
Okay, I've just got a couple of questions quickly to ask, because it seems to me this is a thing that I think we're committed to trying to do. The issue is whether financial pressure is around adult social care. I think we're all agreed if we can up the wages of people in working in adult social care. It's to everybody's benefit. The question is how we're to find the money to be able to do this. So, Rich, there's a figure of around 3.2 million, of which almost all of it is adult social care, as I understand. Is this spread out, the contracts that are coming up, are they spread out over a 3-year period or whatever? And if so, is it sensible to look to see if we can find money to be able to do each set of contracts as they come up? Or do we have to find it all in one fell swoop? And the second thing is, I know that housing have done some work looking at where this was, and when they were very clear that the point of getting the real living wage was to be able to uplift the people at the very lowest, not to then push everything up and keep differentials, then the cost fell substantially. In the work you've been doing with adult social care, have we been clear that when we sign up to the real living wage, that we're trying to make sure that everybody gets to the real living wage, not that we're then trying to then recreate differentials further up?
In answer to your second question, that will be a key part of the focus groups that we'll do. So we'll pull together providers, speak around what the impacts could be. We wouldn't be pushing for them in terms of further restructure. It would just be the living wage aspect. What organisations would then need to do beyond that to maintain differentials will be down to how those organisations seek to deal with those structures. Obviously, as there is a push up on some of the lower levels, if that then means that there is less of a difference in pay between undertaking the lower level up to the next sort of supervisory role, that could mean that there could be uplifts. It will depend upon how the different organisations decide to approach that. What we're aiming to do over the next month is to properly engage with the organisations, and that will be one of the key points on the agenda.
But Rich, if we're getting people to uplift the wages of the very people on the very lowest wages, and we're asking people to do that's our responsibility to pay for. Keeping differentials is not our responsibility.
That's not our responsibility, no.
Absolutely. Okay.
It could be a knock-on effect from it, but it's not our responsibility.
Okay, colleagues, I'm conscious we've got something from Councillor Cal Corkery, which I'm happy to read, so that for the record his view is in here. Is that all right with you, colleagues? Okay. So in relation to the living wage, it's now over a year since the full council passed the Labour motion calling on the council to sign up to become a Living Wage Foundation accredited employer. While the report before us today makes clear that some progress has been made towards the goal, I'm unclear what the timescale is and would ask the committee to seek a clearly defined timeline for making this happen. With soaring energy bills, cuts to universal credit and increasing national insurance contributions all set to hit low-income families in Portsmouth, soon it is now more important than ever that as a local authority we do all within our power to ensure those working in outsourced council services receive a proper living wage. Okay, so that's from Councillor Cal Corkery. Just for the record, I think this committee has already set a time scale, which is to bring us in for the beginning of the next financial year, and that's the project that we're working on. So that's one of the things that Cal didn't seem as if he's aware of, but it's what we've been working on for some time, and I think we have been very clear in this committee across party we wanted to be an accredited living wage employer for a significant number of years now, and we've been working with them. Now, as I understand it, Jess is available from the Living Wage Foundation by phone. I've no idea, James, how you're going to patch her in. Is it like Star Trek?
Thank you, Chair. So just to confirm, Jess Goble from the Living Wage Foundation is currently able to hear us, and should a question be asked to her, her voice will come through into the chamber.
Ooh, an ethereal voice. So my question to you, to Jess, would be, Jess, do you think we're on target to hit the aim that we've had of being accredited for the beginning of the next financial year?
Can everyone hear me okay?
Hurrah, yes!
Great. Yeah, I think I caught most of what was being covered. But yeah, I think overall it looks like the conversations that you're having are moving in the right direction. Obviously, it was really good to see some of the questions around schools being answered in the paper, and it sounds like there's also been progress on adult social care as well, and social care more widely. So that's really, really positive, because that's obviously the most challenging part of accreditation for local authorities. So yeah, I don't think that will be, I can't foresee any huge barriers in terms of accreditation for the new financial year. I think that sounds like a sensible time frame to give you all time to, I guess, get everything in order, sort out the list of milestones that haven't yet been moved to living wage, and agree that kind of timeline as well. So yeah, I think that sounds really good.
Jess, my second question was, are there other authorities who've done this recently that who are social services authorities that we could work with, that you could put us in touch with? At this point, you'll tell me that Norwich City is a unitary authority, and I shall look sheepish and embarrassed. But have you got ideas of people it's best to work with? I know Cornwall County have done it over the last few years, but they're a big rural county,
Yeah.
Which is quite different to us.
Definitely. I've recently become accredited. I mean,
Jess, you're breaking up.
it's not like Sunderland, but it's a kind of setup, I guess, how it's eBay, local authority. Quite recent.
We think you said Sunderland.
Sunderland.
We'll have to get a translation and feed it into the committee, but if it was Sunderland, that sounds good.
Yeah, so yeah, probably the most recent, most similar size and I guess jurisdiction in terms of what I guess the area you oversee that's become accredited within the last couple of years. So yeah, I think that might work quite well. I'll speak to my colleague who works with them more closely to see if she's happy to kind of set up.
Okay, brilliant, Jess. So I'm just
Is
going
there
to...
anyone I should introduce them to specifically, or you drop me an email and we can go from there?
We will. I'm just going to go around the committee and just see if anybody else has got questions for you. Jeanette, any questions? Darren?
Thanks for that, Jess. Would it be okay for your comments to be included in our minutes, because we know you're phoning in?
Of course. Yeah, no problem at all. One other thing, just on social care. Last week we launched a toolkit for implementing living wage and social care for local authorities, but also care providers. So that's helpful as sort of addendum. I can send that over as well. I can share a state with James, and then we can go from there. But that might be something also to include in a sort of an additional thing within the minutes, if that's helpful.
It's up to other colleagues to decide. I think it would be, but just to confirm, you think you're content with the progress that we're making. Is that right, Jess?
Yeah, it sounds really good. From what I could hear, it sounds good.
Excellent. I'm glad you can hear us, but we're delighted to hear you. So thank you very much.
Thank you.
Lewis, any questions? No? Okay. Colleagues, with that update, are colleagues content that progress is being made? So, Jeanette?
So can I just ask a question? It wasn't of Jess. I've always supported the living wage. What I do worry about, though, is the pressure on adult social care, and we're losing care homes at the rate of knots because of the pressures of COVID and government funding. At what point do we go, this is a step too far for our care homes locally, and what happens if they say no?
So I think this is going to be, I think, a really sensible question, because I think there's going to be this is more complicated than it kind of looks, because we contract with care homes that who have some Portsmouth residents, some Hampshire residents, some self-funders, and exactly the same with care providers. If people are doing home care, they'll go sometimes to people who are Portsmouth funded, sometimes to people who are Hampshire funded, sometimes to people who are self-funded. So how do we work with firms, because Hampshire won't be a real living wage employer. What people are charged privately, if they're self-funders, again, is different. And we're going to have to work very carefully with both homes and home care providers to try to make sure that we produce a system which works and make sure people gets the care, but also recognises that we can't pick up the costs for Hampshire residents when Hampshire are not paying for people to be paid at the real living wage. So it is more complicated than I thought, and there is significant pressure on the care system at the moment. I know that we've been contractors are handing back contracts to the council for home care and saying we just can't get people to do the work. Now, hopefully, being a real living wage employer will help that, because it'll become more attractive than Tesco's or whatever. But it'll actually mean that people get a bit better pay than the national minimum wage. But it is a real problem, and it's going to. I think it's not going to get any easier. So this is quite complicated. The other bit we're going to have to think about as a council is, even if we equal this out over 3 years, the savings targets that we've been given that we have to hit is, at the moment, it's £1 million. If we're going to go for the real living wage, and we're able to spread it out over 3 years, that doubles that savings target to 2 million, because we'll have to find an additional £1 million, either of extra income or of service cuts, to pay for the uplift for the cost of the real living wage. So this is not simple and easy. It's going to need a lot of very careful work to try to make sure that we get the right outcomes, both for residents and also for the people working in the care sector. But I think your question is very sensible and apposite. Lewis.
On the 3.2 figure, have we got an idea of that pipeline? Does it split down over the years, or is it all in one, or is it? And also in the report it mentions that the sort of contractor pool is going to narrow by doing this. So has that taken into account in the 3.2, or is that general costs are also going to rise?
Richard, do you want to give some advice?
Yes, of course. The 3.2 at the moment is a straight profile, so some of the work that we're going to be doing over the next month, now that we've got better pipeline data, is to see if there's any significant bumps that would come within those 3 years. If there's a particularly big contract that comes up for renewal, we'll make sure that we engage directly with that particular provider and understand where they are in respect of pay. From some of the research we've been doing, looking at the job websites, so looking at things like Indeed, it looks like rates of pay are already starting to increase due to the factors that have been discussed today of trying to attract new staff in. So there's a bit more work to do at the moment. It's a profiled figure. We'll get some more detail on that over the next couple of months in respect of that. In respect to the next part of the question, in terms of potentially suppliers leaving and not wanting to potentially bid on contracts, again, that's something that we will investigate further, and it will come down to how hard we mandate it. So we could take a very black and white approach on this, which is to say living wage is fully mandated, it's a pass-fail requirement for bidding, or take more of a encouraging approach. If we take the encouraging approach, that can potentially mean that some contracts don't get uplifted when maybe we would want them to be, even though we're incentivising for that to happen. And again, that will fall in some of the work we're doing the next couple of months, looking at some of those really key high dependency suppliers and groups of suppliers to understand what the implications could be for them and whether they would still seek to bid on council contracts in the future.
Darren.
Thanks. Just a question for Richard. We've had some people say that if you ask to do this in the May or the June, you can get us to find the £3.2 million by the following April. Because you bring it in, let's say it was done in June 2021, it can be brought in from April 2022. Based upon your assessment, is that realistic?
I don't think that's a fair question, Darren. Poor Richard is here from procurement, he's not here from finance. But I'm sure the Chief Executive will have an answer because he has an overall view of the whole council.
I'm not entirely sure I understood the question, but it did sound a little bit like you spend now, pay later.
I think the question, David, as Chief Executive, is if we have to find 3.2 million in one go, how tough is that going to be?
That is going to be exceedingly tough, but it's about where the council as a whole places its priorities.
And that it would raise the savings target from 1 million to 4.2 million in the budget we're about to do in the autumn.
Yes, it would. I think just whilst I've got the microphone, I think it's interesting as well. There's a lot going on in the employment sector as well at the moment in terms of broader wage inflation and shortages, and certainly we are seeing that in domiciliary care at the moment. So in addition to the rather tricky equation that Richard and his colleagues will be working through, we've also got a moving market going on at the moment, and whilst, you know, as the leader said, the issues around differentials with our suppliers are not our problem. They could indirectly become our problem because they could distort the market.
Okay, colleagues, are you happy with this as a progress report? I think it's important that we have this on the agenda for each and every meeting, and if we can have connection with Jess to give us that outside view from the Living Wage Foundation, that's helpful. But many thanks to everybody for the work you're doing, and we'll need to keep a very close eye on this. Is that all right, colleagues? Okay, thank you very much indeed. Peter, sickness absence.
Thank you, Chair. Yep, so members will be aware that the Council has been operating in many services differently as a result of the pandemic. Many staff are working remotely. Compared to the start of the pandemic, overall absence levels are down. However, they have increased in some areas during the last 2 quarters. The report was prepared for July, and I'm reading the results for the last or quarter 2 sickness absence compared to the previous quarter of March 2021. In the second quarter, the sickness level has increased slightly from 9.45 to 9.47 average days per person per year, resulting in working time lost increasing from 2.59 to 2.65% excluding schools. Long-term absence has increased from 6.47 to 6.67 average days per person per year, and short-term absence has decreased from 1.62 to 1.56 average days per person per year. We saw a decrease in absence levels in 3 directorates, however 7 directorates saw an increase in absence levels. The highest reason for sickness absence remains due to psychological stress, anxiety and depression. However, neurology and the nervous system and musculoskeletal, back and neck are now listed second and third. Musculoskeletal absences are divided into 3 categories. If they were collated, they would become the second highest ranked reason. So absence levels by directorates for the period of June 2020 to May 2021 are attached in Appendix 1, and a summary of the reason for sickness absence for the last year is attached in Appendix 2. Moving on to wellbeing, finding of the staff wellbeing pulse survey, which ran from the 23rd of February to the 5th of March, are mentioned in the report. The findings showed that the levels of anxiety, stress and nervousness had increased by 3% since June 2020. There was an increase of 1% in staff feeling happier. Over 2/3 of staff stated they are satisfied with the work at the moment. Those working exclusively at home being the most satisfied. Those working both at home and in the workplace are least. The majority of staff feel that they have the tools to work effectively. However, fewer staff feel supported by the council this year. Over 3/4 of staff agree that their team are communicating well and staying connected. And the majority feel supported by the balance of work and other commitments. 61% of staff are able to strike the right balance between work and their personal time. However, a fifth do not feel they're able to achieve this. However, over half of staff can manage their workload within the contracted hours. Almost a quarter disagree with this. The vast majority of staff know where to access wellbeing support at 85%, and 91% of staff have received communications about ways to support their wellbeing.
Peter, I think we presume we've read it.
Okay.
Is there anything else you need to add to the report that's not in it?
I think just to highlight that the Portsmouth Council's wellbeing champions have increased to 62, so again there's some really good effort there. And in adult services they have 25% of those champions, and in children's they have just over 20% of those champions as well, so there's some real focus in those particular areas.
Okay, thanks very much indeed. Colleagues, any questions for Peter? Jeanette?
On Appendix 2, you sort of highlight the psychological stress, anxiety and depression, and it's split off into work-related. What programmes are in place for both of those, especially the work-related one, because that's quite high? And is that connected to why people aren't feeling supported?
Yes, I think there have been a number of wellbeing campaigns to help anxiety around 5 steps of wellbeing, and they've been held in July, and the wellbeing officer is actually returning in October to revisit and reinforce, but also establish how well those have been received. In children's, the Wellbeing Coordinator will be delivering 2 sessions on the 28th and 30th of September to team leaders, and there is also a new programme training their staff on motivational interviewing. This will be aimed at helping the families they support, but should also have a knock-on effect to how they support and interact with each other. 9 dates are booked for this from September to November. So there is work there focused on the particular areas.
And that sounds really great, but does that mean that most of the work-related stress was in children's? Or what's happening to the wider area? Because children's and social care are always known as the stressors and the stressor jobs because of the nature of what they do, but what about the rest? What about the poor admin person?
Should we let Peter start and then Natasha can come in after?
Yeah, there are a number of initiatives organisational wide, and indeed now they're literally looking at introducing support around hybrid working, and there's lots of online tutorials as well that the L&D team have been promoting throughout the last sort of 6 months or so.
Thank you. I think it's probably also important to reflect on the period in time around which this particular data relates to. We were at that point in the pandemic, but also reflecting on the wellbeing survey that took place during that period as well. A lot of the stress and anxiety you can correlate to much higher workloads that staff are experiencing across the organisation. This isn't just in adults or children's. I think it's council-wide across all roles, and particularly for staff who are working from home, who are reporting through the feedback that they're working longer days, they're using what would previously been a commute time to carry on working, as well as working much longer hours. So hence the renewed focus and continued focus around well-being initiatives across the piece, particularly focusing on mental health and giving managers the tools to help them to work with those staff. But clearly we need to continue the work to support staff, but also address staff anxiety and address the workloads that staff are experiencing.
Sorry, Chair, just one final point, and I accept all that, and it's a full sort of programme of events. One thing I would say though is sometimes online events, especially during the pandemic and when people have been working from home, online isn't the best way of doing it. It's trying to bring people together as safely as possible, but trying to bring people together to start doing that network, because that's the bit that I think they miss the most. But that's just an aside. But thank you for your work. That's great.
I completely agree with you. I think that's a really important part of how things should move. I've been discussing with Natasha, and I think it'd be a useful report to come back here about how we move forward from here, because there won't be one size fits all in terms of returning to the office or whatever. And there's been really useful learning out of things. For some people, working from home has worked absolutely brilliantly and wonderfully, and their productivity has shot up, and it's worked really well. And in which case the sensible thing to do is to keep it. But for other people it's not worked well, and we'll need to know and understand in each area how that's going to work. But I think it's a logical thing to bring back here for us to look at that in some detail, if that's right. Personally, I've enjoyed working from home. The only problem I've found is it's been too close to the fridge, which would account for me getting bigger. Darren.
I too would support Jeanette in what she was saying around trying to get people back. I know other councils such as Havant are looking at hybrid working and hybrid meetings and those sorts of things. I think that may be something we may need to look at as we go forwards.
Of course, Natasha.
Thank you. That is exactly what we are looking at going forward, and we are still delivering some training face-to-face where we have to, particularly for adult social care, where you have to have face-to-face contact, but we're obviously doing that in a COVID-safe way. We do recognise the importance of that face-to-face contact, so we are encouraging teams to have contact. I know a lot of colleagues who are having walking meetings outdoors, meeting in open air environments, wherever it's possible to do so, not always to discuss work issues, but simply to have human contact with colleagues, so that is happening as well.
Okay. Oh, sorry, Lewis, my apology.
Just to follow on from that, obviously the idea of outdoor meetings and stuff is brilliant. While we have this weather, we've got a massive building across the road. What's being done to make sure that can continue as we move into choppier waters, so to speak?
I think, as the Chair has outlined, we'll bring a report back, because that's all part of the considerations. We have a working group working on that at the moment, and it includes how we use that space and do it in a COVID-safe way.
Because I think the way in which particularly the civics worked over the pandemic has been good. People have come in when there's been a need. Sometimes people have not come in where there's a need because we didn't understand the processes, and that's caused us problems in planning. But the way in which people are using the one-way systems, etc., and people wearing masks, they're going around the building, etc., it is good. But I think Jeanette's point is really strong. People do need to get together and have human contact as teams at some points, and we'll need to find ways of making sure that can happen. Okay. All right, folks, we're happy to move along? Okay. Health and Safety Annual Report. Linda.
Thank you. If the committee permits, I would like to take this opportunity to introduce myself. Good afternoon. My name is Linda Martin. I'm the new Corporate Health and Safety Manager for Portsmouth City Council. I started in April of this year, so I'm just coming up to 6 months in post. I'm a chartered member of the health and safety professional body, the Institute of Occupational Safety and Health. I'm a resident of Portsmouth and previously worked for the university. The committee has received today...
Welcome.
Thank you. The committee has received today the annual report to the 31st of March 2021, an update on last year's action plan and my action plan for 21-22. My purpose today and my purpose along with my team is to ensure the health and safety of well-being of those affected by the Council's activities and to ensure compliance with health and safety legislation. We will do this by providing specialist advice, guidance, training and documentation to all services. From the action plan you will see that I am reviewing health and safety activities throughout the Council and it is my intention to provide an update to, we've got a health, safety and wellbeing forum. We meet regularly in advance of this committee in case anything should require to be brought to this committee. Consultation on health and safety matters is very important and is a legal requirement. So I've already built good relationships with the unions. I'd like to propose to this committee that I provide updates on health and safety activities and progress on an annual basis.
Thank you very much, Linda, and welcome. Thanks for your report. Very helpful and useful. Can I ask, do you cover the port as well?
The port has got a separate health and safety manager, an organisational structure, but we work very closely together.
Fine.
We are liaising and he comes to the Health, Safety and Wellbeing Board.
Thanks, because it's probably one of the most dangerous places that working environments that we have. Okay, colleagues, any questions to Linda? Jeanette?
First of all, welcome.
Thank you.
And I hope you enjoy your time here.
Thank you.
It's about the risks in the report, item 6, and I noticed that you ended up saying about a yearly report, and this is normally a yearly report, I understand that, but I'm just wondering if COVID and the health and safety risks on that, should we have a more regular report based on COVID and anything else that sort of comes in during the year? But and I don't know what partnership you have with health and whether you sit on the same committees, and if I'm doubling your workload, please tell me.
I had got a note as well that we also support colleagues in relation to COVID risk assessments, working very closely with all areas of the service, including public health, and with mitigations for COVID across all of the council, the outlying offices, not just the civic. So I'd be happy to come and report if you wished me to, more regularly than annually.
I would like to see a report, not every employment committee, but at least every second one, just so we know that we are conforming to that health and safety practice.
Okay, are you happy with that, Linda?
Yes.
Okay, colleagues, are you happy with that? Okay.
Thank you.
Right, Meredith.
Thank you, Chair. I'd just like to say that Linda's report covers the period from March 2020 to April 21, and Linda joined about 19 days after the end of that period. And I just wanted to say, if I could publicly, a great deal of thanks for the team of Andy Keel, Teresa Cooper and Kim Langley, who've held the fort before Linda arrived, working with a temporary manager for a period of time, but certainly supported a wide range of services across the council and schools during quite a testing last 18 months. So if I could add that to the item, I'd be grateful. Thank you.
Thanks very much. Thanks, Meredith. I'm sure we'll be very happy to note that. That's good. Okay, colleagues, you happy to move along? Okay, reward and recognition. Peter?
Thank you, Chair. I will try and zip through a little bit quicker this time. So, following the Employment Committee held on the 22nd of September 2020, the members requested a further report which outlined what the Council had already done, what existing mechanisms were already in place for recognising employee resilience and hard work during the ongoing pandemic, and to outline the options that would be put in place for the future. So the range of practices already in existence are outlined in Appendix 1. There have been a number of communications via corporate communications from the leader and the chief executive, publicly thanking and commending staff for their efforts during the pandemic. In December 2020, an additional day's leave on Christmas Eve was provided as a gesture of goodwill. Appendix 2 details what other local authorities used to reward their staff during the pandemic, and an additional day's leave was the mechanism that was used by a number of those councils. We have had requests from trade unions for a day's leave to be granted to all staff as soon as possible. They feel it could they believe that the staff are fatigued and should be rewarded sooner rather than later. Unite, the union, has also requested a payment of £500 per member of staff as a reward. It was communicated to the unions that this was outside the remit of the trade union meeting, but they could raise this with councillors directly via deputation at the Employment Committee. The report also lists the pay challenges of local government, and I think my colleagues here have started to touch on that earlier in the meeting. It also highlights how important reward and recognition can be on culture, how it can build a really strong culture or how it can disengage staff. And it goes on to highlight non-monetary and monetary recognition. And it also details the different levels, whether that be organisational, team or individual recognition. So we move back to the recommendations, which are on page 1 of the report.
Thanks, Peter. Natasha, anything you'd want to add to this? No, David? No, okay. Colleagues, seem to be the recommendations are sensible, and I'm conscious that some people will have problems taking all of their leave, and so giving them an extra day is difficult, but I think it is the right thing to try to do to give people a bit of an additional break over the Christmas and New Year period, and therefore I'd be happy to propose that as it's in the papers. I don't know if anybody's got any other thoughts, or if we're all okay with the suggestions here in the paper. There was silence. Okay, is everybody happy with this? Okay, thank you very much indeed. Okay, now quickly moving there, where have I got to next? I think the Gender Issues Subcommittee, which is a separate piece of paper, and we've got another thing from Cal Corkery, and I have to say I completely agree with him in what he has said, and I'm a bit bemused how it's come out this way. So, so as I understand it, we're asked to set up a subcommittee to do an appointment for new Director of Children's Services, and it's down to us to do. If I read, I don't know, Natasha, do you want to introduce this first, and then we can come to Councillor Cal Corkery's or Cal's suggestion?
Thank you. Yes, so it is the purview of the Employment Committee to delegate appointments of chief officer roles to an appointment subcommittee. So the purpose of the paper in front of you is to, first of all, confirm that you'd like to delegate that responsibility to a subcommittee, and then to determine the composition of that subcommittee. The previous resolution of the Employment Committee identified the proportionate membership. We have received nominations, and I have a small update to those. For the Liberal Democrat group, the paper says that the Lib Dem nominated members are yourself, Councillor Vernon Jackson and Councillor Susie Horton. That has changed now by way of verbal update to be Councillor Susie Horton and Councillor Ben Dowling. We have nominations from the Conservative group for Councillor Ryan Brent and Councillor Terry Norton, and nominations from both the Independent group and the Labour group are to be confirmed. The resolution previously passed by the Employment Committee suggested that There is a rota system in place for representation from either the independent group or the Labour group, but it is for this committee to determine what the composition of the committee should be. So there we are.
And I think Carol has a very good point. There are 7 Labour councillors, and I can't see a reason why they should be excluded. Actually, we should be inclusive as opposed to trying to exclude people. So, for the record, I will read out what Carol has sent so that it is on record. He said, I would like to put my name forward to be on the subcommittee and propose the recommendations are amended to allow for 2 Conservative councillors, 2 Lib Dems, 1 Labour and 1 Independent. The report refers to previous arrangements. However, since these were put in place, the Labour group has grown in size. In addition, it hardly seems fair or proportionate that, for example, the Lib Dems have 15 councillors, should be entitled to 2 on the committee, but Labour have 7 and should be entitled to 0. End of thing from Cal, and I completely agree with him. And you therefore have a nominee from the Labour group. Is Cal their spokesman on children's services? So, Jeanette, do you know who is?
As far as I'm aware, it's Kirsty.
It was
Is it Kirsty
the last. That may be true now, Jeanette. But the last paper for the July meeting had Judith as it. As
Okay. Well, okay, it's down to the Labour group to choose, but it's. I think my view was that Susie should be. I shouldn't be there. Susie is deputy leader, but also she has that portfolio, and therefore it is right that she chairs this and that she runs it. And Ben has an educational background, so again has more knowledge than I do. But I think it's absolutely right and fair that it should be all 4 groups on the interview panel. I would completely agree. So it should be 2 Conservatives, 2 Lib Dems, 1 Labour, 1 PPP stroke independent. And Jeanette, I'm sure you will talk with colleagues about who that will be. Is it likely to be you?
It's me.
Oh, it's you. Okay, fine. That's simple then. I think that's my. I think we do need to go back and revisit, because it can't be right that Labour with 7 councillors might be excluded from things in the future, and I just think that's not right. We need to make sure that we have a look at this again. My other question is, we do this is for interviews for directors only. Assistant directors, are there member panels to do those interviews?
No, they are chief officers will be directors and statutory officers, so monitoring officer, chief executive, section 151, but not necessarily assistant directors. And
I think we should look at that again, but I don't want to make a snap decision, but could we have a paper to come back here about to look at what the right level of delegation is, because some of the assistant directors have very, very significant areas of responsibility, and for members to have no input into those selections causes me some concern. Colleagues, are you happy with the paper coming back? Okay. At which point, I know it never says on the agenda, is there anything else anybody would like to bring up that we haven't been on the agenda with? Jeanette, anything we need to cover? Darren? Lewis? No. In which case, that's it. Thank you very much, everybody, for your time today. Have an enjoyable rest of the day. Thank you, James.